Namaskar, I'm Dr. Shweta Bansal. Very warm welcome to all my seniors, colleagues and mentors. Today there is an occasion of International Childhood Cancer Day, 15th February, and we are trying to create awareness about the childhood cancer among ourselves and among the parents as well as the whole society. So childhood cancer, why it is important? I would say childhood cancer nowadays becoming an important social issue because many patients are getting diagnosed, and it is our responsibility as a pediatrician to rightly guide them and help them in their treatment. So this International Childhood Cancer, this time the theme is through your hands. It means giving the right care at the right time and by the right person, and hence guiding them to the right person at the right time to the right place is the responsibility of us as a pediatrician. Most important thing is we need to understand as a pediatrician, and we know that as a pediatrician that children are not small adults, they are different. That's why the childhood cancer is also quite different from the adult cancers. And it has been seen in many studies, those children who are treated by pediatric oncologists, they do much better as compared to the children who are treated by adult oncologists, and there are many international studies. With this, I would like to come on the signs and symptoms which we need to recognize as early as possible so that there could be an early referral for these patients. Any patient who is walking into the OPD, any experienced pediatrician, any good doctor can tell whether this child is very sick, really sick, or just require any first aid only. I would say there are many common signs and symptoms which actually happens in childhood cancer also and in common illnesses also. But when to raise flag is the important issue. So any child who is having anemia along with other cell lines affected, like if they are having a WBC count on the higher side, the platelets are on the lower side, and the child is losing weight and the child is not taking interest in the surroundings, he is not playing, he is complaining of body aches, and he is having a fever which is not responding to the antibiotics for a long time, then definitely this should raise a flag, and then we need to investigate this child further. Then, so fever, anemia, pancytopenia, body aches, having a bleeding, gums, ecchymotic spots on the body always indicate that something sinister is going in the child and we need to investigate the child further. Other set of symptoms is for the brain tumors. If the child is having a vomiting, headache is getting relieved after vomiting, then definitely this is a situation where we need to investigate further. A child is having a difficulty in walking, having a vomiting, headache, difficulty in walking, he is losing his vision or he started having a squint, then again this is a set of symptoms in which we need to investigate further and most probably indicates towards the brain anomaly or brain tumor. Then another set of symptoms is that if the patient is complaining of backache. So children never complain of backache. If the child starts complaining of backache, which is progressive in nature, and he starts having difficulty in walking, and he starts limping or starts becoming bedridden and doesn't want to go outside because during play or something he starts complaining of pain, then again this should raise an alarm and we need to investigate as early as possible. Another symptom is that the child abdominal size is increasing. There is an increase in the liver and spleen size. There is a distension is happening. The patient is passing red color urine. If we check the blood pressure of the child, he is having a hypertension, then definitely this indicates toward the abdominal tumors or kidney tumors like Wilms tumor or neuroblastoma. And in the abdomen, we can have Burkitt's lymphoma also or sarcomas also. Similarly, with the adolescent child, if the adolescent child comes with the complaint of painless or even the painful increase in the any of the bone or any of the joints, then mostly the patients, they complain that they had a fall or while playing they had a injury, and after that this injury is not getting healed up or they are having a increase in the size or swelling. Then we need to do the investigation. Initially the x-ray needs to be done. We need to rule out whether there is osteomyelitis or not. If it doesn't look like osteomyelitis or there is any doubt it could be more than osteomyelitis, then definitely CT scan or MRI should be done. Another symptom is any painless growth in any part of the body, like lump. So it can happen near the neck region or any region of the body, and if it's slowly growing, it is painless, then not to be ignored and completely needs to be investigated. So these are the few of the symptoms which are very important and red flags signs, I would say, which we cannot ignore and we need to further investigate. Now coming to the investigations. So many of the, I would say one example is there that one of the mother who was actually having a feeling that a child is not doing well or his child is not himself, and he actually persisted that I need to do the CBC of the child, which most of the pediatricians, they said no, it is not required because child is just because of the weather he is feeling like that. But mother persisted and she did the CBC, and on the CBC we saw some abnormal blood cells. We did the bone marrow and child was diagnosed with the early leukemia. So these are the few things which we need to take care of it. One is that do the CBC if there is any thing which indicates toward any kind of abnormality or any different in the child's behavior or nature along with other signs and symptoms. So if the CBC shows some abnormal cells, then it needs to be further investigated by doing a bone marrow aspiration and biopsy accordingly. Similarly, if there is any lump, then we need to do FNAC or biopsy. I would say FNAC is not good because we can miss many of the diagnoses in that. So anything which is like core biopsy or excision biopsy can be done, which can actually help in diagnosing the disease properly. I always come across this question that these are expensive investigations and why to do it initially. So I would always say that saving a life is very, very important, and these investigations may not prove very costly or actually costly if we are ultimately able to save one life because of early diagnosis. So we need to keep all these things in our mind. Then doing other investigations, like we are always have a dilemma that we should go ahead with the bone marrow aspiration or biopsy. I would say that we can do the bone marrow aspiration and biopsy, but we should always keep in mind that if we are strongly suspecting leukemia or any other bone marrow failure syndrome, then we should have the provision of sending these samples for further investigations also, because once you refer the patient and these the reports are not available, which includes the cytogenetics, immunophenotyping, and sometimes next generation sequencing. Then we have to repeat the bone marrow in these patients, and sometimes the parents then don't like it. So it's always good to have a complete provision of sending these tests, and then we should plan for these tests. Now coming to the treatment part, the treatment of this childhood cancer is quite effective, and now 70 to 80% of the childhood cancers are curable. I would say most of the leukemias are curable, lymphomas are curable, even the abdominal tumors, which include Wilms tumor, is highly curable, and Hodgkin's lymphoma, osteosarcoma, and Ewing sarcoma. These are some of the common childhood cancers, and very good cure rates are there for these cancers, especially if the protocol-based regular treatment is taken for these children. So what is the role of the pediatrician when the child is embarking on the journey of a childhood cancer treatment? I would say whenever I treat the child, we always keep a close contact with the pediatrician, because they are the first contact with the parents, and second is the family has a lot of trust in the pediatricians, and pediatricians can help us in counseling and sharing the burden of treating these children, and because of the shared care, best results can come out. And after the treatment also, the follow-up is required, and if they follow up with the pediatrician, this can help the family a lot. So with this, I would like to end my talk, and if there are any further queries, you can mail me on this email ID which is written down. Thank you.